Eating disorders are complex mental health conditions characterized by abnormal or disturbed eating habits, which can significantly impact an individual's physical and mental health. These disorders often stem from a combination of psychological, biological, and sociocultural factors. The most common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Understanding these conditions is crucial for early detection, effective treatment, and supporting those affected by them. Types of eating disorders. Anorexia nervosa. Anorexia nervosa is characterized by an intense fear of gaining weight, a distorted body image, and severe food restriction. Individuals with anorexia often see themselves as overweight, even if they are dangerously underweight. This disorder can lead to extreme malnutrition and numerous health complications. Bulimia nervosa. Bulimia nervosa involves cycles of binge eating followed by compensatory behaviors such as vomiting, excessive exercise, or the use of laxatives. People with bulimia often feel a lack of control over their eating during binges and are usually of normal weight or overweight, which can make the disorder less noticeable. Binge eating disorder. Binge eating disorder is characterized by recurrent episodes of eating large quantities of food, often quickly and to the point of discomfort. Unlike bulimia, binge eating episodes are not followed by purging behaviors. This disorder can lead to obesity and related health issues. Other specified feeding or eating disorder, OSD. OSD is a category that includes eating disorders that do not meet the criteria for anorexia, bulimia, or binge eating disorder but still cause significant distress or impairment. Examples include atypical anorexia nervosa and purging disorder. Symptoms and signs of eating disorders. Symptoms of eating disorders can vary depending on the specific disorder but often include a combination of physical, behavioral, and emotional signs. Anorexia nervosa symptoms. Severe restriction of food intake. Intense fear of gaining weight. Distorted body image. Excessive exercise. Amenorrhea, loss of menstrual periods in women. Thinning hair and brittle nails. Cold intolerance. Osteoporosis. Bulimia nervosa symptoms. Recurrent episodes of binge eating. Compensatory behaviors such as vomiting or excessive exercise. Preoccupation with body shape and weight. Swelling of the cheeks or jaw area. Dental erosion from stomach acid. Electrolyte imbalances. Gastrointestinal problems. Binge eating disorder symptoms. Eating large quantities of food in a short period. Eating when not physically hungry. Eating until uncomfortably full. Eating alone due to embarrassment. Feelings of guilt or shame after eating. Fluctuations in weight. OSD symptoms. Symptoms of eating disorders that do not fit into the categories of anorexia, bulimia, or binge eating disorder but still cause distress and impairment. Causes and risk factors. Eating disorders are believed to result from a combination of genetic, biological, psychological, and sociocultural factors. Genetic factors. Research suggests that eating disorders can run in families, indicating a genetic predisposition. Individuals with a family history of eating disorders may be at higher risk. Biological factors. Biological factors, including hormonal imbalances and brain chemistry abnormalities, can contribute to the development of eating disorders. Neurotransmitters such as serotonin and dopamine play a role in regulating mood and appetite. Psychological factors. Certain personality traits, such as perfectionism, obsessive-compulsive tendencies, and low self-esteem, are associated with eating disorders. Trauma, anxiety, and depression are also common psychological risk factors. Sociocultural factors. Societal pressures and cultural ideals emphasizing thinness and body image can significantly influence the development of eating disorders. Media portrayals of unrealistic body standards can contribute to body dissatisfaction and unhealthy eating behaviors. Diagnosing an eating disorder involves a comprehensive evaluation by a healthcare professional, including clinical interviews, detailed interviews that explore the individual's eating behaviors, thoughts, and emotions related to food and body image. Medical history, a thorough review of medical and psychiatric history to rule out other conditions that may mimic eating disorder symptoms. Physical examination, assessment of physical health, including vital signs, weight, and examination for signs of malnutrition or other complications. Psychological testing, standardized tests and questionnaires to assess eating disorder symptoms, personality traits, and psychological health. Laboratory tests, blood tests to check for electrolyte imbalances, nutritional deficiencies, and other health markers. Impact on physical and mental health. Eating disorders can have severe physical and mental health consequences, affecting almost every organ system in the body. Physical health complications. Malnutrition and nutrient deficiencies. Cardiovascular problems, including heart arrhythmias and heart failure. Gastrointestinal issues, such as constipation and bloating. Bone density loss and increased risk of fractures. Muscle weakness and loss of muscle mass. Electrolyte imbalances leading to seizures or kidney failure. Dental erosion and gum disease. Mental health complications. Increased risk of anxiety and depression. Substance abuse disorders. Suicidal thoughts and behaviors. Social isolation and relationship difficulties. Cognitive impairments, such as difficulties with concentration and memory. Treatment and management. Effective treatment for eating disorders typically involves a multidisciplinary approach, including medical, nutritional, and psychological interventions. Medical treatment, medical monitoring is crucial, especially for individuals with severe eating disorders. This includes regular checkups, management of physical complications, and sometimes hospitalization for medical stabilization. Nutritional counseling. Registered dietitians specializing in eating disorders help individuals develop healthy eating patterns, achieve a balanced diet, and address nutritional deficiencies. Nutritional counseling also involves meal planning and education on proper nutrition. Psychotherapy. Several types of psychotherapy are effective in treating eating disorders. Cognitive behavioral therapy, CBT, focuses on identifying and changing distorted thoughts and behaviors related to food, body image, and weight. Dialectical behavior therapy, DBT, helps individuals develop coping skills to manage emotional distress and reduce harmful behaviors. Family-based therapy, FBT, particularly effective for adolescents with anorexia. FBT involves the family and the treatment process to support recovery. Interpersonal therapy, IPT, addresses interpersonal issues that may contribute to the eating disorder. Medication. Certain medications can be helpful in managing co-occurring conditions such as depression and anxiety. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed. Support groups and peer support. Support groups and peer support can provide emotional support, reduce feelings of isolation, and offer practical advice from others who have experienced similar challenges. Self-care and coping strategies. In addition to professional treatment, self-care and coping strategies are essential for managing eating disorders and promoting recovery. Develop healthy eating habits, establish regular meal patterns and balanced nutrition with the help of a dietitian. Practice mindfulness and stress reduction. Techniques such as mindfulness meditation, yoga, and deep breathing exercises can help manage stress and reduce emotional eating. Build a support network. Surround yourself with supportive friends, family, and healthcare professionals who understand and support your recovery. Set realistic goals. Set achievable goals for your recovery and celebrate small victories along the way. Engage in positive activities. Participate in activities that promote a positive self-image and boost self-esteem, such as hobbies, sports, or volunteering. Challenge negative thoughts. work with a therapist to identify and challenge distorted thoughts about food, body image, and self-worth. Avoid triggers. Identify and avoid situations, people, or media that trigger negative emotions or unhealthy eating behaviors. Challenges in treating eating disorders. Treating eating disorders can be challenging due to several factors. Denial and resistance. Individuals with eating disorders may deny the severity of their condition or resist treatment, making it difficult to engage them in therapy. Relapse. Eating disorders have a high relapse rate, and maintaining long-term recovery requires ongoing effort and support. Co-occurring disorders. The presence of other mental health conditions, such as depression, anxiety, or substance abuse, can complicate treatment and recovery. Stigma. The stigma associated with eating disorders can prevent individuals from seeking help and support. Complexity of the disorder. The multifaceted nature of eating disorders, involving physical, psychological, and social factors, requires a comprehensive and individualized treatment approach. Research and future directions. Ongoing research is essential for improving our understanding of eating disorders and developing more effective treatments. Areas of focus include genetic and biological research. Identifying the genetic and biological factors that contribute to eating disorders can help in developing targeted treatments and preventive strategies. Neuroimaging studies. Advanced brain imaging techniques are being used to study the brain structure and function in individuals with eating disorders, providing insights into the underlying mechanisms of the disorder. Novel therapeutic approaches. Researchers are exploring new therapies, such as neurofeedback, transcranial magnetic stimulation, TMS, and psychopharmacological interventions, for treating eating disorders. Early intervention. Developing strategies for early identification and intervention, especially in high-risk populations, can improve long-term outcomes and prevent the progression of eating disorders. Personalized medicine. Advances in personalized medicine aim to tailor treatment plans based on an individual's genetic makeup, lifestyle, and specific needs. In conclusion, eating disorders are serious mental health conditions that require comprehensive and multidisciplinary treatment approaches. Early detection, effective treatment, and ongoing support are crucial for recovery. By raising awareness, reducing stigma, and promoting research, we can improve outcomes for individuals with eating disorders and support them in leading healthy, fulfilling lives. Understanding the complexities of eating disorders and the various factors that contribute to their development is essential for effective intervention. With the right combination of medical, nutritional, and psychological support, individuals with eating disorders can achieve recovery and reclaim their lives. Ongoing research and advancements in treatment offer hope for better outcomes and improved quality of life for those affected by these challenging conditions. Thank you for watching. Please subscribe, like, and share.